Hello, this is post-operative day number 16, recovery day number 16, and I've begun to walk without the cane and the walker, although sometimes I do use the cane, sometimes I do use the walker. Here's my, excuse me, here's my walking without any assistive devices. And I think you can see the swelling is more improved. You can get a look at the wound. The steri strips or paper tape strips are still covering the wound. It's 16 days now. I'll probably take those off shortly. I have had an area of inflammation that I think is the membrane overlying the tibia, and I think it's something like shin splints, or you might call it a periostitis, inflammation of the membrane over the bone, periostitis. It's been redder, it's been very tender, it's been so tender that even the sheets resting on it have been uncomfortable. The bruising is significantly less. And part of the reason I had the surgery done, besides the pain I had with my first total knee replacement, was out-toeing. And they've corrected some of the out-toeing with this surgery, but I still out-toe. I put on these sneakers that I wore 2 years ago without any problem. They have larger heels, and I have to walk a wide base gait to keep the right heel from hitting the left foot, because I'm heeling in and toeing out on the right side. So if you watch me walk, if I try to walk with my feet close together, there's a rubbing of the right heel against the left foot. The left foot's moving normally. So I have to walk with a wide base gait to avoid the collision of the right heel with the left foot. So even when I recover from this surgery, I expect I won't be able to walk quite normally. Hopefully, I won't have the pain I had before with the first total knee replacement. Time will tell on that. There's also some clicking when I walk in the knee that I feel. But the clicking isn't associated with any particular pain, and I've been told that it's normal for knee replacements to click. The physical therapy maneuvers, such as the bringing the foot underneath me, underneath the thigh while sitting in the chair, and then sitting forward, may be becoming a bit easier. I can't tell that I've made a whole lot of progress, but I don't think I've had any backsliding at all either. The physical therapist was here yesterday and measured my flexion at 95 degrees. And he said my straightening was 1 or 2 degrees short of full extension. Another exercise the physical therapist gave me is tying the strap around my ankle. It's a yoga strap. And slowly stretching the quadricep muscle by pulling on the strap, laying flat on my stomach, and holding it for 10 or 20 seconds to stretch the quadricep and get more flexion in the knee. I might mention that I started driving the car about 7 days ago. This is day 16 now, so about day 9 I started driving the car. I only drive distances of 5 or 10, maybe 15 minutes, run an errand and come back home again. No long car drives. So once again on the stationary bike, which I do against no resistance at all. I'm not trying to develop strength. I'm just doing this to get range of motion, going backwards, back pedaling, a little easier than forward pedaling as far as getting over the crest of the cycling stroke. I can go forward too. I do this most every day, not for very long, but just to try and get the flexion in the knee that will allow me to bicycle again. Bicycling is one of my favorite things to do. I mentioned I'd been driving for 7 days. I want you to know I am not taking any narcotics. I'm just taking ibuprofen and Tylenol or acetaminophen for pain. And I do have some pain and discomfort. Not particularly while doing this, but just generally with activities. And this is my demonstration of my day 16. Your day 16 may be very different.